Hello, and welcome to part 6 of our lecture series on the urinary system. And in this lecture, we're going to take a look at the blood supply to the functional units within the kidney. Now, if we take a look at this from a kind of a gross anatomical level, you've got the renal artery, which is a branch of the abdominal aorta, which is going to be carrying the blood flow into the kidney proper. And again, it's going to be entering into the hilus. It's going to be entering into the kind of indented region within our kidney bean type structure. And again, keep in mind that lots of blood flow to the kidney, about 20% of the blood flow for the body is going to be going into the kidney, even though the kidney is about 1% of the volume of the body. So disproportionate large amount of blood going to the kidneys, indicating the importance of this filtering mechanism that we've been talking about. Now what happens is that renal artery is going to come into the renal hilum. It's going to branch into the interlobar arteries, and the interlobar arteries are essentially going to be between the lobes, those lobes that we talked about, the renal lobes that we talked about early on in this lecture series, but basically delineated by the medullary pyramids. And so it's going to distribute the blood from the renal artery through these interlobar arteries into a series of arcuate arteries. And the arcuate arteries are, you can think about them as being arched arteries. They're going to be located along the border between the cortex and the medulla. And so, in essence, what we've got is a system where we're going to rapidly deliver the blood to the cortex of the kidney. And the cortex is going to be where we're going to have the important mechanisms with this blood filtering that we're talking about. And so, in essence, those arcuate arteries, those arched arteries, are essentially going to branch off into the interlobular arteries, interlobular between the lobules, between those renal lobules that we talked about, again, with the medullary rays towards the center of them. The interlobular arteries between the lobules are going to branch off at right angles to those arcuate arteries and go up into the cortex, and it's basically going to be branches off the interlobular arteries, which are going to be our afferent arterioles. They're going to deliver the blood into our renal glomerulus to allow for that filtering to occur. And so, again, the afferent arterioles are going to be carrying a large volume of, you think about it as normal blood, into our glomerular capillaries. It's going to go in through the vascular pole of our renal corpuscle, and the blood is going to flow through our glomerulus. Again, keep in mind the glomerulus is lined by fenestrated capillaries, so they've got little pores that are going to be present there. We've got the podocytes with the pedicels that are wrapped around, helping to establish the filtration barrier. But basically, as the blood is pumping through the glomerular capillary beds, we're going to be squeezing out lots of fluid, lots of small molecules, so that what is going to leave our glomerulus through our efferent arteriole is going to be a reduced volume of blood with a lot of materials that have been squeezed out of it. Now, this efferent arteriole then is going to go out and carry the blood into either peritubular capillaries. Capillaries are going to be found around our distal and convoluted our proximal and distal convoluted tubules, staying primarily within the cortex and essentially either carrying materials to them or carrying materials that have been reabsorbed by the cells of the proximal and distal convoluted tubules away from the kidneys. So that can be occurring within the cortical region. Or if we're looking at the efferent arterioles from the juxtamedullary nephrons, they're going to give rise to a series of capillary loops that are going to run parallel to our loops of Henle. And they're going to extend down into the medulla and be referred to as the vasa recta. So again, the secondary capillary beds that we're going to have within the kidneys are going to be the peritubular capillaries. They're going to stay up within the cortex. And again, still circle around our proximal and distal convoluted tubules, carrying away the materials that are reabsorbed by those cells. But we're going to focus in a little bit on the vasa recta, and we indicated this a little bit in our previous lecture series. The vasa recta are essentially going to run parallel to our loop of Henle. So again, think about what's occurring within our loop of Henle is that we've got the descending limb, a hairpin loop, and an ascending limb coming back. We're going to start out with materials within our loop of Henle that is the materials in the lumen are going to be isotonic as it goes deeper into the medulla, as it goes towards that hairpin turn within that loop of Henle. They're going to become more and more concentrated, more hypertonic. They're going to twist around and then come back up through the ascending limb of the loop of Henle from the tip of the medulla back up towards the cortex, and we're going to be pumping the salts out, keeping the water within it. So we're going to go from very hypertonic to a more isotonic urine, a more normal concentration of urine within our uriniferous tubules. The vasa recta, this capillary bed that is going to be running down parallel and following our loops of Henle, are going to have that same loop of Henle. So what's going to happen is, as those capillary beds go deeper within the medulla, we're going to have the blood losing the water, because the water is going to get out of the blood system. It's going to pass through our endothelial cells, get into that medullary interstitium. And it's going to also pick up the sodium, pick up the concentration of materials that are deep within the medulla. But as we're coming back up, that the vasa recta, blood vessels, the capillary bed, they're going to be running parallel to our loop of Henle. As they're coming back up, we're going to have, again, permeable to water and permeable to salt, and that's different from our loop of Henle. So that as the blood is coming back up towards the cortex, it's going to equilibrate with the tissues and ultimately become isotonic again. So even though the blood, as it goes down into the medulla, is going to get very concentrated, very different from what we're going to see in other regions of the body, as it turns around and comes back up, because it's permeable to both salt and water, as the blood vessels are carrying the blood back up towards the cortex, it's going to become more normal, it's going to become isotonic, and it's going to be the same as the blood in other regions of the body. And again, that's going to be important for both maintaining that osmotic gradient that's established within the medulla. We're not going to do anything that's going to affect it, but it's going to allow us then to keep these cells alive and provide them with oxygen and nutrients. And I think I jumped ahead a few slides. Yeah. Okay, I lost my my intermediate slide. So that's going to finish up part 6. As you can see, part 7 is going to take a look at the ureters, the bladder, and the urethra. If you have any questions, feel free to email me at hoffmanj@arcadia.edu. Thank you.